Hi, this is Renee Berger. I'm doing my fourth validation, which is musculoskeletal and neuro. I have Connor with me. Are you okay with me doing the exam on you today?
Yes.
Okay. If you could do a 360 of the room, please, and then take a look back here at the tools that I'll be using. The first part of the exam today is range of motion, which I'm going to be doing on myself. So the first is fingers, have flexion, extension, abduction, adduction, wrist flexion, extension, radial deviation, ulnar deviation, elbow flexion, extension, supination, pronation, shoulder flexion, extension, circumduction, abduction, adduction, neck flexion, extension, left lateral bending, right lateral bending, rotation to the right, rotation to the left. Fingers, wrist, shoulder, neck, spine. Flexion, extension, rotation to the right, rotation to the left, left lateral bending, right lateral bending, spine. We have hips, flexion, extension, flexion, extension, external rotation, internal rotation, knees, flexion, extension, ankles, plantar flexation, dorsiflexion, flexion, inversion, extroversion. And we have toes, flexion, and flexion and extension. Next, we are going to move on to musculoskeletal special tests, which are assessment of the knee. If you could just lay down for me, please. First thing that we're going to do is the valgus test, which is going to test the strength of the medial collateral ligament. So we hold our feet in our hands, and we are going to stress the medial lateral ligament by pushing it in. The varus stress test is going to assess the lateral collateral ligament, and we are going to be pushing out, which is going to stress that ligament. We are also going to assess the knee by doing the anterior drawer test, which is going to test the ACL. So we're flexing the knee at 90 degrees. We're going to have our thumbs on the medial and the lateral collateral, and we pull forward to see if there's any pain.
No.
And the posterior drawer test, we be also flexing. Just leave it like that, and then we push back. Any pain?
No.
Okay. Next thing that we would do is we have the McMurray's test, where the knee is going to stay flexed. This is also going to test for any meniscus injury. So we have with the knee flexed, and we are going to rotate it internally, out, around, and down. Any pain?
None.
Okay, thanks. Next thing, if you want to stand up for me, we're going to test for carpal tunnel issues. The first thing that we're going to do, you can sit down if you want, is we are, let me just turn, I just needed one. We are going to be testing for the medial. We're going to be tapping on the medial nerve here, which runs up and this part of the hand. So we tap and we look for any pain or tingling. Any pain or tingling?
None.
If there were pain or tingling there, it would make us question if there was any carpal tunnel issues. Next thing that we're going to do, if you want to stand up for this one, if you could put your hands back to back. This is the Phalen's test, and hands stay back to back, and we would ask the patient to hold it for 60 seconds. If there was any pain or tingling, that would be a positive sign for possible carpal tunnel syndrome. Any pain or tingling?
No.
Perfect. All right, the next thing that we are going to be assessing is going to be, if you want to sit down for me, we did the carpal tunnel. We are going to test for the sits muscle. So we are going to assess the back. I'm gonna need you to turn around here, I'm sorry. So the sits muscles, we have the supraspinatus, the infraspinatus, we have the teres minor, and the subscapularis. So that makes up the sits muscles, and that is, we're assessing here for any issues with rotator cuff injury. So I'm gonna ask you, do you have any pain as you're,
No.
no? Okay. And I'm gonna ask you, I'm gonna push down, and I want you to move your shoulder against the resistance of my hand. So if you could just move your shoulder up for me. Any pain?
None.
Any problems? Okay, so that would be a test that we would look for to test the shoulder strength and to see if there's any possible rotator cuff injury. So the next thing that we need to do is we are going to do the scratch test. So if you could stand up for me. And if Connor had a problem with his shoulder or his rotator cuff, we would be doing it first on the unaffected side. He doesn't have any issues, so what I want you to do is take your one hand and put it back like you're scratching, and then the other one up like you're scratching, and you're going to turn around. All right, can you do it on the other side? Thank you. Obviously, he doesn't have any issues there. Stand up, keep standing up for me. The next thing that we would do is the drop arm test. We would hold this out at a 90-degree angle. You want to keep it at 90 degrees. You don't want to move it any higher than that because you would be using the bicep muscles versus the muscles that you would be checking out for the sits muscles. And you would hold it out, and if they are not able to maintain that, and if the arm dropped, you would it would be positive that there could be some issues for rotator cuff. Next thing that we're going to do is an assessment for scoliosis. So we are looking at the height of the shoulders, we are looking at the iliac crest, we are looking at the gluteal folds, which obviously I'm not going to touch, but you're looking for symmetry there, you're looking at the scapula for any winging. If you want to bend over for me, we want to make sure that there's not any curvature in the S. We want to make sure that when he's bending down that it is that there's not any curves to his spine, which there's not, so we are good. If you want to lay down for me, the next test that we're going to do is an assessment for any possible low back pain. So, you know what, I'm sorry. Can you stand back up for me? The first thing that we're going to do is we're going to palpate. We're going to go along the muscles of the paravertebral muscles down his back. Any pain?
None.
And we're going to go right over the spinal process. And we are going to just palpate to make sure that there's not any pain. Any pain?
No.
If he had any complaints of pain, we would consider that there could be especially over a bone, we would consider a spinal fracture. So now I want you to pay attention. The next thing that we're going to do is the raised leg test to test for back pain, and I don't have a whole lot of room here, so if you could just kind of work with me here. So we are going to raise his leg up, and if he complained of pain, which you don't have any pain, we would just bring it back down to just a little below where he was complaining of the pain, and that would be putting some pressure on the nerve root. It could tell us that he's going to have some pain in the back for that. If we did this on the same side, which have your leg, and you would do the same thing on the other side. If you would raise it to the point where there was pain and you drop it down a little bit, you would still experience the pain on that side, on the affected side. Thank you. The next thing that we are going to do is an assessment of tendon reflexes, and they are graded from 0 to 4 plus. The first thing that we are going to do is the supinator, which is C5 and 6, and we use the flat end of the hammer for that. So I don't know if you'll be able to see here. Okay, and then we move up to the tendon right here, and that is the bicep, that is C5 and 6, and we use indirect pressure on this. We move to triceps, which is C6 and 7. which is behind the elbow. Just kind of leave it. And then we have the next one we're going to do is the knee, which is going to be L2, 3, and 4. And I know you're too tall here, so I'm just going to kind of rest. You just rest your leg on my leg here. And that is for the knee, that's L2, 3, and 4. The next one is ankle. And again, we're just going to have to rest your knee in my hand. That's going to be for S1, and just hold your foot up for me. Okay. So that again is going to be assessing the deep tendon reflexes. So that is that. The next thing that we are going to be assessing is neuro for Brudinsky's. If you could put your chin to your chest for me. What we're looking for here is a smooth motion. If we would see any contractions of the arm or the leg, it could give us a hint that there could be an irritation of the meninges. The next thing that we're looking for is Koenig sign, and if you could just lay back down for me. What you do here is you flex the knee and then the hip, and if there's any pain, you're going to do both of these, and if there's any pain or resistance, you could suspect that there's some kind of meningeal irritation. The only caveat with that would be that if somebody also has low back pain, you could get a false positive on that. The next thing that we're going to do is the Babinski's. So if you could just give me a right here. This is a sign that is would be a normal sign in an infant or a young child. It usually goes away by age 1 or 2. So I'm going to draw a J on the foot. In the infant or the child, the toes are going to fan out. In an older child, other than the infant, if it's above 2, or especially in an adult, if we saw the fanning of the toes, that would be an abnormal sign. So you just draw the J, and you're looking for the toes to stay in place, which they do. So that. The next thing that we are going to do is an assessment of walking. So I'm just going to ask you to kind of walk, and if you could follow along with me, just walk along with me. Just walk. Perfect. Now I'm going to ask you to walk heel to toe. Thank you. Good. Can you walk on your toes for me? Perfect. And can you turn around and walk back on your heels? Okay, we are going to do, back over here, we're going to do the Romberg sign. So what you're going to do is you're going to have your feet together. You need to have your palms out, with your eyes closed, and I just want you to close your eyes and hold that. And what we're looking for is not any drifting. We want his hands to stay put. Thank you. So the next thing that we're going to do is the pronator drift. And what we're looking for is, I want you to close your eyes and put your hands like that. And you're going to push them down. And I want you to return them to where they go. Perfect. The next thing that we are going to test is, if you want to sit down with me, these are rapid alternating movements. So can you just follow my hands? And just make it, can you go faster? Thank you. And then we have, can you do this? Thank you. And can you put your heel in my hand? And down on the floor. And then heel, down on the floor. Just like this. And do it faster. Thank you. Okay. And I want you to close your eyes. And I want you to take your fingers and put them out in front of you. And touch your nose for me. Perfect. Thank you. And open up your eyes. And what I want you to do is follow my finger, and then I want you to touch your nose. So touch your nose, touch my finger. So take your finger and touch your nose, touch my finger, touch my nose, touch your finger, touch your nose, touch my finger. Thank you. So we have, we did that. The next thing that we are going to do is, vibratory sensation, which is, I want you to close your eyes, and every time you feel the vibration, I want you to just let me know. Okay, so we're gonna start here.
Feel it. Feel it. Feel it. Feel it. Feel it. Feel it. Feel it.
I want you to close your eyes for me and just put your hands out. What I'm gonna do is I'm gonna ask you if I'm pushing your finger up or down. So we're looking for the person to be able to differentiate if the finger's going up or down with their eyes closed.
Up. Down. Down.
Okay, and then the next thing that we are going to do is assessment for pain or soft. So this is gonna be sharp, that's gonna be soft.
Alright.
Close your eyes.
Sharp. 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 Soft. Sharp. Soft.
Thank you. So that was our pain and softness. The next thing I'm going to ask you to do is I'm going to ask you to close your eyes, and I'm going to put a familiar object in your hand, and I want you to try to tell me what it is.
Key.
Okay, yes, thank you. And I'm going to draw a number on your hand, and I want you to tell me what that number is.
3.
3, got it. Thank you. So that ends the key test that we did is called the Sterignognus test, and that's just the ability to have the object identification with your eyes closed. And that ends the last validation. What was my time?